What, honey?
I put my
I don't have my hearing aids in, but that's okay. I can hear myself.
All right, I've got the chalkboard.
Okay. Welcome to our kitchen classroom. We've been going a couple weeks, so it's fun to be back and to kind of get caught up on everything. I really feel the next 3 weeks are the core or the heart of what I want to tell you. It's almost like, not that what we talked about before wasn't important. It was, right, Joe? It was important, Courtney. But this is really the demonstrations, and this is what, as a consumer of the standards of care, that you need to know. I had Courtney just take a picture of my chalkboard up there, and that's what I'm talking about all the time. The standards of care, how to communicate, and the concept of the clinical instructor, and also respect. That's kind of my bottom line. You need to be respected when you're in the hospital, and that's important to me. So I thought I'd put all those words up there again and just reiterate it. And then I got thinking, as I was waiting for Courtney to come, I was thinking of the word patient. You know, we never think of that. What is the word patient? And I know at one time nurses were thinking of calling patients clients because that involved more interaction. It was less of a passive word. But it didn't fit because a client is someone that comes and pays a fee to one person, and it just wasn't right. Patient is what we have, patient was what we get. But do you know what patient means? I got my dictionary. I always like to go back to the meaning. So patient, bearing or enduring pain, trouble, without complaining or losing self-control. Ooh. Refusing to be provoked or angered as by an insult. Tolerant. Calmly tolerating delay, confusion, inefficiency. Wow. Able to wait calmly for something desired. Showing or characterized by patient. They're all words that are opposite about what I believe a patient-caregiver relationship to be. And I think everybody's bought this definition. People go to the hospital, okay, I'm going to the hospital, I just turn it over to these professionals. They know what they're doing. And they do. I'm not challenging that. I'm just saying for your own safety, you need to know what they're doing and be able to ask good questions. Not critical questions, but knowledge-based questions. So that, I think that was, don't you think that's interesting, the definition?
I don't think that's the real definition of the patients that we're talking about.
Well, this is the definition that we've grown up with. Yeah. Courtney, you even said last time we were together, that when you went to the hospital, you just assumed that you turn it over to the experts, you know. And I think a lot of it has been brought up with this definition. Now, my definition is not that. My definition is not passive. It's interactive. So I think you're absolutely right, Joe. I want to just start with that. But I thought that was kind of interesting. Okay, one other thing, just you know how I am. I get off on a tangent a little bit, but I think I'm okay. Last time we were together, I showed you this ad in the New York Times about the bedside. And basically they say, right now, because hospitals refuse to hire enough bedside caregivers, we are forced to care for up to 19 patients at a time. Okay, I took that number 19 and I decided to divide. I did my little calculations here, Joe. And I looked at a typical nurse and I tried to, what do they do in business? They do like a timeline, a work line. They divide chores into certain bits of time. It's got a name. Do you know what it is, Courtney or Joe? It's like a timeline.
Like shift? Like different shifts?
Well, the nurses have the shift, 8 hour shift. But what I did is I took that, say a nurse has 19 patients, okay? So it takes her, she gives medication twice a day, BID, 10 and 2. About 5 minutes each to give the medication, thereabouts. It's an estimation. So in that 8 hour shift, she spends 10 minutes giving medication. She's supposed to check the medication, check the patient, ask for allergies, et cetera, okay? She might have, of those 19 patients, she might have 10 injections, let's say. Pain injections, something like that. Each injection will take her 10 minutes anyway to draw it up and get it up and check and do all she's supposed to do, he's supposed to do. She also spends about 15 minutes at the beginning of the shift getting a report from the nurses who are leaving. And at the end of the shift, she gives a report to the nurse. So 15 minutes, thereabouts, I'm saying. She might have, out of that patient, she might have 19 patients, she might have 8 of them that have IVs. Could be, basically. And, maybe adding a bottle, clearing the tubing, checking it, monitoring, checking the arm, 15 minutes. Maybe 8 of those patients, maybe 6 or 7 have catheters, maybe post-operative unit, probably. So she's got to monitor those. And then she might have to transport patients, and then she'll have a dressing change. If she got a good, and I'm going to show you the dressing change. If it's a dressing change may take 20 minutes to 30 minutes, times post-operative unit. 10 patients have dressings out of those 19, maybe more. I'd probably say the whole 19. Okay, and then she's supposed to help the patient get out of bed, ambulate, cough and deep breathe, set them up to wash themselves. 15 minutes a patient. I mean, they consolidate. So I hit it up, and I did with 8 patients. It was actually 140 minutes, and with the 11 other patients, I figured it was about 550 minutes. Now, anyone can check my math, but what I came up with, actually, in an 8-hour shift, they had to give 23 hours worth of care. Now, they do it because they consolidate, and they put, they're smart about how they take care of their care. But you've got to understand, I said this last week, it forces them to hurry through their care. And they don't like that. Nurses are trained to be meticulous, careful, protect the patient, say all the good things that they're trained. And when they have all that, how can they do it? I just don't know how. You can check my math later on, honey. I didn't.
Probably wrong.
Probably wrong, well, okay. But whatever, you're going to have to, you can check it for me. Okay, one other thing. Will you please share this video with somebody? I've always said I want to change the world. I like to help individual people, but I would like it to be the norm. That the patient and family comes into the hospital, they know the standards of care. It's a given. Everybody knows that. The caregivers know that. And these patients and families know how to ask questions. It's just not an odd few of people in California or New York City. Everybody knows how to do that. That's what you change normative behavior. You change the view of it. And I have had trouble getting through to people. I don't know why. What am I doing wrong, Joe?
Nothing. You're doing fine.
I'm trying. But you are the only people that can help me. I noticed today, I read yesterday that a gentleman up at Lake George had done a beautiful video of the ice that was melting. It was over time, and I guess it was lovely and, more popular. And 187,000 people watched it. I can see why. I want to look at it too, but how do I get people to watch my video? And the only way I can do it is if you help me. So I'm going to keep on asking you to help me. Okay, Joe?
Fine.
Okay, all right. I've done everything I can, but okay, today let's go right to the dressing change. Let's start with the beginning. Okay, I'm going to show you how to put on sterile gloves. Oh my goodness, that's no big deal, right? Everybody does it all the time. Every TV show, they're always putting on those sterile gloves. But nurses are taught a certain way to do it. So I got some sterile gloves. They come in some sort of package in the hospital. You open them up. They have the left hand and the right hand. And you open them up very carefully. You don't want to contaminate the gloves, correct? You open it up. There you got your sterile gloves. Got them, Courtney? Mm-hmm. Okay. Now, I happen to be right-handed. So what I am going to do, I'm going to pick up the left glove like this. And I pick up the part that's going to go against my skin. Okay? And then I put that on very carefully. I work it up very, very carefully because I don't want to contaminate the, and if you got it, and they are more skilled than I. Now I just contaminated. Did you see that? Okay, let's start over. You can't do that. That's exact. And if I contaminated my gloves, I throw them away. I don't use them. You got to be able to say to yourself, so let's try again. Picking it up by the cuff here, putting it on, make sure I get all my fingers in. Okay, I bring it up here. Okay, this is all sterile. This I touched is contaminated now because it's against my skin. Okay, I got my left glove on. Now I come over to my right glove and I go underneath. I go underneath the cuff. See, I got sterile fingers. I got a sterile glove. See what I did, honey? Okay. Now I put my hand in here and I get it in all my fingers carefully. Okay, I got it in. Now I bring this up. Now I don't do this. That's for, I just bring it up. I mean, you see it on
That's
TV.
for flair.
That's flair. That's kind of, wow, I did it, you know. I just bring it up and set it up, but there's a little. Now I got 2 sterile gloves on, correct? Now this is how the nurses were taught to do it. After a while they can do it quicker than I did, obviously, but it's the same principle. And I wanted you to know that right from the beginning, this is how a nurse is taught. And this is, you can watch them put on their gloves. Kind of interesting. And if you saw them contaminate the glove, ooh, it looks like maybe you touched something with that glove. They may not like that, but it's your body. The other thing, nurses are taught to not wear any kind of ring, because the ring could make a hole in the glove. I think they probably will put their engagement ring down, maybe. There's a way to use it, but a lot of people don't like to wear that kind of jewelry anyway when they're giving care, because they don't want to contaminate something that's precious to them. Wear your wedding ring fine. Okay, now you may say, oh, why is she spending time with that? But this is a beginning idea of what you need to do when you're giving care. Okay, I have a patient that needs a dress. How am I doing with time, hon?
You are at 13 minutes. You've been going.
Okay, we should be able to. If we can give me a little more time, or I can add another one to it, because this is kind of. Let me get rid of my. So, I have a patient that needs a post-operative dressing. Probably it's the first day post-operative, so it's a fairly complex dressing, and I'm always aware of the sterility that I have to do. There may be some doctor's orders about the type of dressing that need to be done. There could be a drain that's within, more than likely there would be a drain there, and this is the whole thing. First thing I do, I go into the patient and I let them know that I'm going to do the dressing. And if it's the first day, I might see that they get their pain medications a half an hour before, because they might be a little tense, and you know, there's the movement around an open wound can be painful. So I assess that ahead of time, and then I go in and I let them know what I'm going to do, okay? What I need is, I'll get rid of my coffee here. What I need, I get all my equipment together, okay? I get everything that I need for the dressing, because I knew this is the kind of wound or what kind of healing that's needed to be done. So I get everything together and I come into the patient. I probably use the overhead table, make sure everything is cleared over. And the first thing I do, and I wasn't able to get one of these, but I'm going to put out a sterile field. It's wrapped up, it's all sterile, and it's a plastic kind of material, and I take it out and I open it up and I only touch, now this is something I cut an old bit, I lay it down here and I don't touch any of this part. I lay it down so I touch the bottom part of it. The bottom part is plastic on it. It's treated with plastic, and the reason that is you don't want fluids to go up into the sterile field. Because let's face it, if you have anything that is wet, those little germs, those microbes, they get up them right away. So I have my sterile field. I'm standing up, obviously, I do it. Nurses are taught, once they set their sterile field up, they don't leave it. You know, you got the sterile field, you're not supposed to leave it because someone could touch it, a fly could land on it, the wind could come in and blow a curtain on it. If you have established this area here, you make sure that you watch it and take care of it and watch it carefully. Then you come in, and basically what you do is, depending on how they open it up, there'll be a way to open it up. You put down your dressings on the sterile field, and you open it. They'll be easy to open up. This is one I got from the drugstore. But you put them down one at a time. Depending on how many you need, you know, you put them down there one at a time. You pile them up. You know the kind of dressing. You have extra ones in your pocket. Remember, you don't have your sterile gloves on now. Okay, you're setting this up. You don't have your sterile gloves on because you're not working with them. Okay, and I got these gauze squares. I got another pair of gloves. These are called abdominal pads. You usually have some type of top dressing that would be an abdominal pad. And I put this on. Remember, I'm not going to touch anything. I have to do it carefully. Goes down. There it is. I'm going to just show you this. Just these abdominal pads. I'll show you later on. They're thick and they're the top that goes on the dressing. Okay, a lot of them there. I might have to have some normal saline, so I have a plastic. Now this is not one of them, but it's a prettier one than usual. But usually they're plastic. That's on there, sterile.